Okay, what's up, y'all? Let's take a deeper look into the reproductive system. In this video, we're going to focus on the body parts that support in pregnancy and birth. There are both internal parts and external parts. So, here we have a body that is facing forward as if they're looking at you. The parts of the body that are a part of the reproductive system are the mammary tissue and glands in the chest region, which are responsible for producing milk to feed an infant or child. These are external body parts. Then we have the uterus, uterine tubes, ovaries, and the vaginal canal, all of which are internal structures and contribute to hormone production, housing and releasing eggs, aka ovulation, supporting a fertilized egg to grow into a fetus, housing the fetus until it's time to be born, aka pregnancy, or releasing regularly if no pregnancy has occurred, aka menstruation. Then we have the vulva, which is an external structure that consists of the clitoris, outer lips, the inner lips, the urethral opening, and the vaginal opening. So, shall we take a deeper dive into the amazing system? Let's zoom in magic school bus style so we can get a better view. Let's focus on the inner structures first, shall we? First up, we have the uterus. The uterus is an organ that is the shape and size of an inverted pear and lives in the bottom half of the body in the pelvic region. Take a look back at the entire body for a second, and you can see here that the pelvic region is located from just below the belly button to just above mid-thigh. The uterus is the strongest organ in the human anatomy system and has the ability to grow and shrink in size. How cool is that? The uterus is made up of muscles and is quite thick. At the top of each corner of the uterus are the uterine tubes. These tubes are directly connected to the uterus and act as corridors or pathways between the ovaries and the uterus. It looks like the ovaries and the uterine tubes are connected, but they actually aren't. They are in very close proximity, but at the end of the uterine tubes, you will find the fimbriae. These structures support in the eggs that are inside of the ovaries to make their way into the uterine tubes where fertilization usually occurs. These finger-looking like structures essentially pick up the eggs and usher them into the uterine tubes in a sweeping-like manner. In addition, the uterine tube has a contracting ability that pushes the egg through the tube. The ovaries are almond-sized and shaped structures that are small in size but mighty in responsibility. The ovaries are responsible for housing and distributing the eggs. This is 1/2 of the genetic contribution of a human. Each human needs an egg and a sperm to form. Fun fact, humans form their eggs at about 6 months in utero during the gestational period, and thus we carry 2 generations worth within us if the fetus has ovaries. So, your grandmother carried the egg that was inside of your mother that then became you. Okay, I digress. Back to the ovaries. So, back over here to the ovaries. The ovaries and the brain are in frequent communication. The pituitary gland is about the size of a blueberry and is located at the base of the brain. It is sometimes referred to as the master gland because it's responsible for the functions of the endocrine system like the thyroid glands, ovaries, testes, and the adrenal glands. With the help of its neighbor, the hypothalamus, a hormone cocktail of mostly estrogen and also progesterone is released regularly. Hormones carry messages from the brain to structures and organs of the body to function. This is one huge factor in the length of one cycle. So, now let's go back to the zoomed in version of the ovary so you can clearly understand this next part. By direction of the brain, the ovaries release an egg, sometimes more than one, midway through the cycle into the uterine tube. This process is called ovulation. When the egg is released, various other parts of the reproductive system change as well in preparation for a potential pregnancy. One of the greatest transformations during ovulation is of the uterus. There are various layers to the uterus. Right now, we will focus on the inside wall of this amazing organ. As you can see, we will split the uterus in half. One side, you're looking at the outside of the uterus, and the other side, you're looking at the inside of the uterus. Right here is the muscle and thickness of the uterus. The uterus is made up of muscles that span across in every which way, making a beautifully intricate weaving pattern. This is the only organ in the human anatomy that is structured quite like this. This unique design affords the uterus the ability to grow, expand, and to contract. It is phenotypical to have a cycle much like the moon. Just like the moon waxes and wanes, the uterine lining, referred to as the endometrium, becomes thick and vascular in preparation for a fertilized egg to embed itself, and then if there isn't a fertilized egg, the vascular juicy lining will shed itself and is referred to as menstruation. Estrogen supports in this process of the wall thickening and is referred to as the luteal phase of one's cycle. The cycle consists of various phases where the shedding of blood is the beginning of the cycle. Then the body releases hormones that prepare the eggs to be fertilized. This is called the follicular stage. Then the egg releases from the ovaries, which is called ovulation. Then, if there isn't a pregnancy, the cycle repeats. The process can take about every 3 to 4 weeks on average. If there is a pregnancy, then the cycle halts and the body focuses on growing and nurturing the fetus. When the egg releases into the uterine tube, the uterine lining is at its peak thickness. It looks similar to a juicy, ripe crimson fig. Multiple semen dance their way up to meet the egg within the uterine tube. Typically only one, if fertilization even happens, fertilizes the egg. If more than one sperm fertilizes an egg, then this can lead to twins. They dance hand in hand down to embed themselves into the cushy endometrium. An egg that is fertilized is called a zygote. The zygote buries itself deep into the endometrium. The endometrium provides the protection and nutrients that the zygote needs to grow into a fetus. Okay, so one of my all-time favorite body parts is the neck of the uterus. It is the only part of the human anatomy that has the ability to essentially disappear and then regenerate back to its initial form. Do you know what it's called? If you guessed the cervix, then you are correct. The cervix isn't its own structure, but rather an extension of the uterus. There is a very small opening in the middle of the cervix called the cervical os. This is how the blood releases from the inside of the uterus through the vagina and outside of the body. The cervix is also an erogenous zone, meaning it provides sexual stimulation and pleasure. The vaginal canal is made up of stretchy tissues that are constructed similar to an accordion. This means they have the ability to stretch and grow, which is important to allow a baby to pass through. Glands spacing the surface of the vaginal canal release fluids that support in cleaning and regulating the pH balance of this system. The cervix also releases fluids and discharge. This is important because these fluids also change throughout the cycle. For example, during ovulation, the fluids become more alkaline and sticky, similar to snot, which supports in the survival of the sperm. Now, shall we explore the external parts? What you're looking at is the vulva. The vantage point is as if a person was lying down on their back with their legs open. The vulva consists of multiple parts. First up, we have the almighty clitoris, which is the only body part in the entire human anatomy whose sole purpose is to provide sexual pleasure. What we are looking at is actually just the tip of the clitoris, however. The bulb of the vestibule is the complete clitoral structure. The bulb of the vestibule fills up with blood when one is aroused or during labor in these chambers here. This blood rush stimulates the glands in the vaginal canal to secrete fluids that lubricate the vaginal canal and vulva. It also adds pressure that massages the penis if entered inside of the vaginal canal, which stimulates it to ejaculate and release semen. This is one way to have sex. The urethral opening leads to the bladder. As you see, it's right under the clitoris. This is where urine is released. The labia majora, or commonly called the outer lips, right here, they span from the top covering of the clitoris, called the clitoral hood, and travel down to the vaginal opening. Humans who have begun puberty will have hair on the outer lips. This is called pubic hair. Then there are the labia minora, commonly called the inner lips. They span from the top of the covering of the clitoris, called the clitoral hood, and travel down to the vaginal opening. Very little, if any, hair grows here. It is normal for the labia to be various sizes. At times, the inner lips are larger and protrude out more than the outer lips. Either lips may be small, large, thin, thick, flat, long, smooth, or wavy. All are normal. The vaginal introitus, or opening, leads to the vaginal canal. For vantage point, you can also see the anus, or commonly called the butthole, which leads to the rectum and colon, connected to the digestive system, and is where poop releases from. The vulva is oftentimes referred to as the vagina, but technically the vagina is internal and the vulva is external. The last external structure of the reproductive system are responsible for creating milk to feed an infant or child. These structures are located at the chest region. Internally, they consist of adipose tissue, aka fat, collagen, connective tissue, structures to store the milk called mammary glands, and tubes that the milk flow through called lactiferous ducts or milk ducts. Phenotypically, all of the lactiferous ducts or the milk ducts lead to the nipple where the milk releases from. Here is what we call the mammary gland. The mammary glands are found in all bodies. However, the glands can transform in some bodies post-puberty and during pregnancy. These glands' main function is to store and release milk. The lactiferous ducts are the pipelines that the milk flow through, connecting the mammary glands to the nipple where they release. The opening of the milk ducts are so small that they cannot be seen by the naked eye, but there are many spanning the surface of the nipple. When the nipple is pulled on via suction, so by a baby or like a pump, for instance, it stimulates the mammary glands to contract, which then pushes the milk out. Oxytocin is one of the prominent hormones that contribute to the releasing of the milk from the mammary glands and facilitates this contracting motion. On the outside, you have the areola, Montgomery glands, and the nipples. So now what you're looking at is the outside of the human breast. The vantage point is as if someone is looking directly at you. Let's begin with the areola. The areola is usually darker so that the newborn can find it, as they can only see contrast when they're first born. It's phenotypical for the areola to become even darker during pregnancy to assist the infant in finding its food source. On the areola, you see these little bumps that are called Montgomery glands. These glands have a few functions. They produce oil to lubricate and also keep the nipple area clean. And they also support in the components of the milk in a real-time feedback loop, supporting the body in creating customized milk for the infant feeding. I know, super cool, right? Then we have the nipple. Many people think this is where the baby will latch onto. However, a proper latch is actually on most of the areola, and the nipple is situated at the back of the baby's throat and squirts milk down the throat. Therefore, the nipple's main purpose is to just release the milk. So, this sums up the reproductive system. I hope you learned something today. Until next time.